All right, team. Sorry for the clickbaity title there. I'm not going to try and use the Bible to prove that any of this stuff is bad for our health. The science on it is clear enough as it is. So, got another book here, Wheat Belly by William Davis. Been out since 2011. Really groundbreaking stuff. Fascinating impacts on my own life from it, and personal experiences talked about in the book here. The basis of it is, well, I had to do this video right now because I just saw on Zoe, a YouTube channel, a doctor on there talking about how bacon congeals in your blood and causes heart disease, and I had to do this one today immediately after seeing that. It just fired me up too much. So the way it works is there is one food group that to a T has some pretty nasty elements to it. And that despite us having the most advanced technology, our kitchen, believe it or not, your stove and your refrigerator are amazing advances in technology. We have great difficulty still overcoming this with that technology. So it ends up being grass as the most deadly food group for our bodies. We just stop eating grass, everything will be fine. If we could eat grass, we would just cut our yards, and if we have yards, and bake us some grass and everybody be hunky-dory. But unfortunately, we cannot sustain life off of grass. That includes the roots, the stems, the blades, and the seeds of grass. So I don't eat the seeds of grass. Well, that's because we've renamed them, and we call them grains. And so the way it works is we have wheat, oats, rice, and corn as our seeds of grass. And all of them contain a carbohydrate, which is a simple sugar called amylopectin A. And it will increase your blood sugar higher than if you ate the equivalent weight, gram for gram, teaspoon for teaspoon of raw white table sugar. Now, when I try to explain this to people, they never believe me the first time. It always takes going into their lab work. My sugars are fine. I have no issue. What's your A1C? What's an A1C? I don't even know what an A1C is. And then we get into their lab work and we look at their A1C, and they're pre-diabetic. And their doctor has been telling them, oh, your labs are fine. Don't worry about it. We'll get into that maybe in another video. But if you look up the glycemic index of foods, this is a rating on what the effect that these foods have on your blood sugar levels. To a T, wheat, oats, rice, and corn, in just about every form we prepare them, raise your blood sugar higher than teaspoon for teaspoon of raw white table sugar. When I go and see a bunch of diabetics, they are like, oh, I don't eat sugar anymore. I've cut sugar out. Then why are you still diabetic? You're eating grains. You're raising your blood sugar higher than the exact same amount of sugar would have done. You could even maybe say it would be better for you to just put in 6 tablespoons of sugar instead of eating 30 grams of Cheerios in the morning. And we'll get into that a little bit more here in a second. So next up, after the super duper sugar spike that we get from consuming grains, we have gluten. Everybody thinks of gluten as, oh, you don't have celiac disease, you're fine. Well, it turns out it's even worse than celiac disease. And actually, I consider celiac disease, people who have celiac disease, to be blessed because they don't have to deal with this. So gluten is a protein. Okay, we all need proteins, right? Well, actually, this is one of the only proteins on the face of the planet that we cannot break down completely, meaning proteins are made up of individual amino acids. We break almost every other protein down into the individual amino acids. We can't do that with gluten. At best, we can get it to 4 or 5 chain of amino acids. This then goes to the brain and attaches to the exact same receptors as opioids attach to, meaning we get high when we eat gluten and consume 30 to 40% more calories as a result. One of the things I always like saying is, yes, there is an opioid epidemic in America, but it is not the Percocets, it is the gluten. So forget about the celiac disease, and only 1% of the population gets an effect to gluten. Actually, 100% of the population mounts an innate immune response. They're just the fortunate ones who do an autoimmune response to it. But everybody gets an excitatory factor of their opioids going on and eats more as a result. Re-stimulates their appetite if they have it at the end of the meal. Next up, we've got phytic acid. This is another anti-nutrient that actually takes minerals out of your body, not just from that meal. If you are 40 years old and you've ever broken a tooth and you brush your teeth twice a day, what is going on? Why would your teeth break? Because you're consuming foods that actually take minerals out of your body. There is no plant out there screaming, please come eat me. They all want to make children just like most of us do. They have defense mechanisms. They can't run away. We have actually bred these defense mechanisms to be more effective to fight off certain insects and fungus. We'll get into that here in just a second. So, see a lot of people with iron deficiencies. They do the stool test, they get the scopes up and down, and no bleeding. What's going on? Why are we deficient in iron? I don't know. Could it be that the very foods that we are told to eat 50% of our diet of are taking it out of our body? Most people have osteopenia and porosis as we age and we start stooping over. Your calcium's gone. Why is that? We spike our blood sugar so high that it decreases the acidity of our blood, and our brain makes our bones release calcium in order to rebalance that out. It also then further just takes the calcium out of your body by binding to it. We lose zinc for immunity. We lose magnesium for all kinds of things. Atrial fibrillation is an epidemic in this country, and a lot of people, just by taking a magnesium supplement, a very specific one, magnesium bicarbonate, can actually improve and reverse this condition. Lastly, we've got copper. Don't worry, you don't need copper for anything. And then one of the other substances, wheat germ agglutinin, another protein classified as a lectin, another anti-nutrient. We have actually bred this to be the strongest it possibly can be in our grass. What wheat germ agglutinin does is it protects the seed and the young plant from insects and fungus. We could consider it an insecticide. Great, we've got it strong. Our wheat supply is good to go. It's going to fight off insects. There is a chemical in the insects and fungus that wheat germ agglutinin reacts with in order to kill them. It is called glucosamine. Many of you have probably heard of glucosamine and chondroitin taken together to help joints. Why would that be of any benefit? The wheat germ agglutinin attacks glucosamine. There's another one called sialic acid. But guess where we have glucosamine in our bodies? The entire digestive tract, mouth to anus, meaning acid reflux, constipation, diarrhea, ulcerative colitis, Crohn's disease, all kinds of fun things happening, dysbiosis in our digestive tracts due to wheat germ agglutinin attacking glucosamine that lines our digestive tract. Guess where else it is? It's in our arteries. This doctor on Zoe was talking about how bacon grease congeals and you can see it in your pan when you leave. That's because it's at room temperature. In the medical community, we have something, a term called ART, achieving room temperature. That means you're dead. So yes, when you're dead, your blood will congeal just like a bacon grease in a pan will at room temperature. Anywho, this attacks the glucosamine and sialic acid in the lining, the single layer that lines all of our arteries, creating the nice little holes for what actually causes heart disease to form, just like how smoking damages arteries. This does the same thing, damaging your arteries, damaging your digestive tract, attacking the glucosamine and sialic acid that line all of this. It's in our joints, it's in our eyes with cataracts, dry eye syndrome, all kinds of fun stuff that this just attacks in the body. So for people who take glucosamine and chondroitin, you can think of it as a decoy for the wheat germ agglutinin to attack instead of it actually attacking your body. So yeah, lots of fun stuff about grains here. So the way this actually works is If you Google small LDL, JAHA, that is the Journal of American Heart Association. In February 21, they came out with an article posted in there talking about what is the most plaque-causing substance that actually puts plaque into your body. And in it, they state that it's small, dense LDL. And we've always looked at LDL as a bad thing. Well, when you go to your doctor's office and you get your cholesterol done, they measure, it's called a lipid panel. They measure your total cholesterol, your triglycerides, and your HDL, good cholesterol. Then they do a math equation of those three and get a number called an LDL calculated. It is a fictional character that does not exist. You have 0 LDL calculated in your bloodstream, yet all of our medicine is based off of this fictional character that does not exist. So small LDL, how do we, if it's the most plaque-causing substance, how do we measure it? It's not on the standard lipid panel. You get your doctor to order a lipid NMR, nuclear magnetic resonance. My doctor actually turned me on to this one. It is in the book, but he was ordering it beforehand. Doesn't know how to interpret it, but I'm okay with that. At least I'm getting it done. So it will tell you your actual small LDL. And people who have plaque have the high numbers of small LDL, and when you don't have plaque, you have very minimal numbers, ideally less than 500. There is only one thing that causes the creation of small LDL within the body, the most plaque-causing substance on earth. The liver makes it. Why on God's green earth would the liver make small LDL, the most plaque-causing substance on the earth? It has to in response to high blood sugar levels. Blood sugar levels above 140 are so toxic, so inflammatory, so dangerous, so low pH acidity producing instance that our liver is trying to save our lives. And so it's turning all of this sugar as fast as it can possibly try to into small LDL. What is it that raises our blood sugar higher than 140? Sugar, we all get that. We understand that completely. Sugar. I do my blood and I got sugar. Okay, I stay away from sugar. Check on learning. What raises our blood sugar higher than actual sugar? Teaspoon for teaspoon. Your toast, your tortilla chips, your pasta. It doesn't matter if it's whole grain, it doesn't matter if it's white. They all raise your blood sugar higher than actual sugar does. Meaning, grass, amylopectin A, your wheats, oats, rice, and corn, your Heart Association AHA stamped Cheerios raise your blood sugar higher than actual sugar and cause the liver to make small LDL. So the way it works is we consume our grass, our wheat, oats, rice, and corn. The wheat germ agglutinin in it attacks our arteries, making tiny little slices just the same as cigarette smoke does. Then our liver creates small LDL because we've jacked our blood sugar up so high. The small LDL is now able to get into this underneath our initial lining of our arteries and start the formation of a plaque. But because it has gluten in it that is an opioid, we love this food and we can't stop eating it. Think of the foods that you just love. Pizza, rice, bread, just a silly little loaf of we love bread. I know this stuff and it is so hard trying to not eat it because I'm an opioid addict. I get that. I can accept it. And yes, I still give into it from time to time because it's an addiction. It is a true addiction. So we can't stop that. Why do diabetics get their toes, then their ankle, then their shin, then their knee, then their leg, and then they die? Why can't they get their blood sugar levels down? Because they aren't fighting just a sugar addiction. They're fighting an opioid addiction. All right, so just had to get that out there. Let me see if I missed anything. Oh, okay. So I was, well, what can I eat then? There's no food if I can't eat. Yeah, I get it. You're told to eat 50% of your diet out of heart-healthy grains. Believe it or not, there's other food groups out there. So we've got fruits and veggies. We've got nuts and seeds. We've got dairy and milk products. We've got meats. So we're looking at those 4 food groups in the absence of grains. No toast, no bread, no sandwiches, no rice, no chips, no oatmeal, and what are other things? The waffles, the biscuits, and why do we love these foods? We love pancakes, we love waffles, we love biscuits. We love our opioid. We are addicted to opioids. All right, I think that's got it. Okay, so forgot, last update, promise. So recommendation. Speak with your primary care. Make sure you have an A1C done on you and that you know your number like you know your age. It should not be, well, I think I'm in the 5s. There's a big difference between 5.1 and 5.9. One is absolutely perfect. The other's pre-diabetic. Please know your number. The next is never do a lipid panel again. In that same article, they went on to call the lipid panel obsolete. In other words, completely useless. We need to stop fixating on a fictional character that is an umbrella term. We have no LDL calculated in our blood. We have small, dense LDL. We have large, buoyant LDL, and we have VLDL. The small, dense is the most plaque-causing substance, and not even close by any other means. Next to it would be triglycerides as a marker. Next to it would be small levels or low levels of HDL, the quote-unquote good cholesterol. LDL calculated has nothing to do with anything. Okay, so we stop doing the lipid panel and we start doing the lipid NMR, and we focus on our small LDL. And if we are above 500, our goal is to get less than that. And the way we get less than that is to eliminate grains from the diet. The biggest thing I hear is, oh, I don't have that much grains. Okay, what'd you have for breakfast? Toast and cereal. Okay, what'd you have for lunch? Rice with spaghetti. What'd you have for dinner? I had a sandwich with tortilla chips. All you eat is grains. Okay. So if we are above 500, if we have an elevated A1C, which is 5.5 or higher, the total and complete elimination of grains from your diet for 6 weeks. It takes 7 to 10 days to detox from the opioid, the gluten. You will feel bad during this time, just like if you stop taking Percocet, because you are withdrawing from an opioid. You don't have a sugar addiction, you have an opioid addiction to gluten. And even if you go gluten-free, that's just more amylopectin A that they add in there, getting your blood sugar even higher. And there's still the fact of the wheat germ agglutinin and the phytic acid. There is no way around this. So we get our A1C, make sure it's 5.5 or less. We get a lipid NMR done and see what our small LDL, our triglycerides, and our HDL is, making sure that's above 40. And put all of our food into the sunlight. See the circadian rhythm, one from that. 1 hour after sunrise, 1 hour before sunset, we're done eating. That was plenty of time, even in the darkest of winter days. And yeah, that's basically it. That's all you've got to do. And if you want, there is a place in Raleigh called Craft Body Scans. They put on specials for the first time you go do a heart scan. Right now they're doing heart and lung scans for $149 for 2 people. And it will give you a calcium score, which is how much plaque, hard plaque, that we have in the arteries, in the 5 arteries around our heart. I consume a lot of saturated fatty acids. My doctor was pressuring me to start a statin. I had to go spend the money on this, $150 to go get this done. My calcium score was a 0. When I gave it to my doctor, he was like, that's good. I'm like, no, doc, that's incredible. It should not be pot. He's like, this probably isn't even accurate. What? Okay, you're done. But if you have any concerns once you switch away from a no-grain diet or into a no-grain diet and consuming all of your food in the sunlight, go to Craft Body Scans and get a cardiac CT done. You and your husband, you and your wife, 2 people, $75 a piece. Easy peace of mind. All right, I think that's the last update. One little touch up on the LDL. How does the American Heart Association get away with stamping Cheerios if we're saying that this is actually what causes it and not saturated fats? With the standard lipid panel that you get done, when we consume grains, I 100% agree that it does not change the fictional character of LDL calculated. That will stay the same. When we consume saturated fatty acids, it does increase the fictional character of LDL calculated. And that is what gets associated with heart disease. Saturated fatty acids do not touch your small LDL. The only thing that does raise your small LDL is high blood sugar levels. So that's how they're able to get away with stamping it. My prediction, about 2 years, you're gonna be walking through the grocery store aisles and you're just not gonna see the boxes of Cheerios stamped anymore. Nobody's gonna say a word. It's never gonna be announced why. Just like for 60 years or however long they've been put, and now to take it off and whoops, we got this wrong. I just personally don't think that anybody's gonna own up to this and admit it. All right, I swear, this is the last update. And again, for the, oh, my sugar's fine crowd. Your A1C, even if it's in the pre-diabetic range, your doctor's gonna give you no advice on it. You may get, oh, stay away from sugar. That's it. But otherwise you're fine. You're not diabetic. You're good. You're not diabetic. As if there are no risk to pre-diabetes. As if elevating your blood sugar above 140 every single meal is a good thing. But hey, you're not diabetic. And that's on us as providers. I am sorry that we are failing our patient loads or our patient population. So, even if you think you're fine, even if your doctor says you're fine, please invest $25. The best, well, aside from the blue light blocking glasses, red lens, blue light blocking glasses, the best $25 that you can spend on your health is on a finger stick glucometer. You are only ever told to check your blood sugars before a meal. I get it. Even if you're pre-diabetic, you won't even be told to. If you're diabetic, they just say check your first morning sugar of the day. Nobody's told what to do with it. I ask them, oh, well, what does that mean to you? No idea what to do with your blood sugars. Got it. We are terrible at our jobs. Okay. So for those who are, my sugars are fine, invest $25 in a glucometer. Take a morning blood sugar, but then after you eat breakfast, 1 hour afterwards, take your blood sugar again and see what happens. You should never, ever go above 140. Ever. If you are above 140, your food did it to you. What was in your food? It was just 5 crackers. Yeah, 5 tablespoons of sugar. I got it. So check blood sugars 1 hour after a meal and see what it does to you. You should never get above 140. If you are, your sugars are not fine. Easiest way to check it, $25. 2 finger sticks. In the morning, have breakfast 1 hour afterwards. If you're above 140, if you're less than 140, I am sorry. You can delete the out. Your sugars are fine. If you had grains and if you ate 2 slices of, whatever meat or 2 eggs, you're not going to go up above it. But if you had any grains in your diet and you check it 1 hour after you have them, if it's above 140, it was the grains. It's the only reason. And above 140, we're making small LDL. The grains are creating the wheat germ agglutinin to slice the arteries. The small LDL goes in. Got plaque now. Too easy. Back to the book here, one last thing. He notes that a lot of his patients that come in with 80 to 90% blockages on the you probably need to get stented. Talks to them, recommends a grain-free diet if they elect to try it. 3 to 6 months, 60 to 70% blockage. 6 months to a year, 20 to 30% blockage. Once we stop poisoning our body with high blood sugar levels over 140, and if you don't know what you are post-meal 1 hour, please break out of this, oh, my sugars are fine mindset. My doctor said my labs are fine. $25, 1 hour after a meal could save your life. Okay.